The topic is the population explosion in Africa, and Dr.LMadu has given us some almost impossible statistics in reference to this increased population and the impact that it will have not only upon the continent of Africa, but indeed upon the entire world population. Dr. Madu, go on and give us some more of those frightening, in a real sense, statistics in reference to this, because what you're talking about is something that is less than 50 or 60 years from now. Is that what we're saying? And let's go on. I'm sorry, go on.
And like I said, you know, what kind of measures should African governments put in place to control the population methodically? Because it could be a good thing if the population is controlled. So like I said, they might adopt the one-child, two-child policy. That might work. If they can break the cultural and psychological barrier to that, there got to be a lot of education to be before that could happen. Yeah, they could also, educate people on the use of contraceptives, because Africans are not very, both male and females, are not very receptive about contraceptives. Yeah, so that Uganda has been trying a lot, to get people to accept that. Most women, they could also, condoms. A lot of the men over there refuse. From some of the conferences I've had in, about AIDS, I've had those kind of complaints. Most of the men do not want to use condoms, at least as a preventive measure of getting pregnant. That's very critical. And on the other hand, good governance really will be most important, in the scheme of things. When governments, put their hands in the till all the time, siphoning funds that could be used for infrastructural development, that does not help provide the basic infrastructure for the cities to grow. For example, the city of Lagos in Nigeria, which is almost 15 million people, is still using the infrastructure that was built almost 20, 30 years ago for a population half the current size. Okay? So it's difficult to provide for that kind of population when you're using an infrastructure that is
30 years old.
30 years old. Okay. Electricity. In most African countries, electricity is probably, let's see, electricity once a month, sometimes once in 6 months. Why? Because they are using old grids that were 50, 60, 70 years old to supply a population that has, grown almost tenfold. See, like a country like Nigeria, hardly have light. You are using electric grids that were built for probably 60 million people years ago in the 70s to feed a population of 160 million in 2012.
Almost 3 times as many people in the population as it was when it was built.
Yes. So those changes have to be made, and it requires, a proper governance where there will be accountability, so that every dollar brought into the country is used for developmental purposes. And that's very critical if these governments in Africa can arrest the situation. A good example is Rwanda. You know how many people, were slaughtered in Rwanda and all this, but it didn't prevent the population from, exploding. What Kagame is doing now, he started reforesting the country, making sure trees are planted again back to those places where it has been cut. A lot of times, Africans, they cut the fire, the wood to use for fire and all this. So Kagame is trying to reforest the country again, because those things create a lot of erosions, Secondly, he has said, okay, men will have to go through a vasectomy, and they will be paid. They will be given stipends to undergo that process. So if you have 2 or 3 kids, also they say, okay, we got to have vasectomy, that's enough. And that has helped, keep down the population. In Rwanda, like I said before, it's a small country, with the highest density, So that is very, very important. They got to have policies. And there are some African presidents who say, well, our population is our resource. Like President Yoweri Museveni of Uganda. Say, oh, no, we don't worry about that. But then you think of a country like Uganda that's a small country, having 94 million people in 2050, sitting in that small space. There has to be trouble, definitely. There will be trouble. So that population has to be managed. Yeah, during wars, huge population is a resource, like we know. We hear that all the time. That is correct. But then it has to be managed properly in order to become a resource. Yeah, the Chinese population now is a resource. Bigger market, bigger, employment, this capacity, bigger production because of the number of people, because the government has managed, to channel that population. Exactly, channel the growth properly. So India the same. India is booming now because they're managing the population and high employment, high, so that can be managed to become productive. It's not something bad, but the governments have to control it. Uncontrolled growth, population growth, is a panacea for disaster. Even in this city we live, you can see how the city has been expanding, and the the mayor of this city and have been building more infrastructure to accommodate the growing population. And so that's the kind of idea I think African governments have to sit down and plan how to control and manage this population before 2050. Or even at that, how to also use the population in a more productive manner, because that would be important for the future. If it's not managed, then there'll be a lot of problems.
Well, now, that's what I was thinking, Dr. Madu, given what we know about governance in Africa and governance, in many third world countries, and et cetera, does it seem likely that this will be something that they could think in terms of planning and whatever? I mean, and outside of that, then what do you do? I mean, what are some of the consequences of doing nothing?
Well, consequences of doing nothing, you know what the consequences are. A lot of wars, which has already killed millions. The war in the Congo that nobody seems to be talking about anymore, that started in '97 when Mobutu was overthrown, has taken over 5 million lives. 5 million. Nobody has said anything about it. Yeah.
And yet still there's a population growth, even though 5 million folks have been killed over the last since '96.
Exactly, because the population of Africa has been growing instead of decreasing because two factors: high fertility rate, okay, low mortality rate. There's a lower mortality rate now because of better medical care. So people are having more children that are staying alive than dying. One of the reasons why a lot of Africans, when you tell them, well, why can't you have 1 or 2? They say, oh, no, we got to have 5 or 6. It's because out of that 6, they expect about 3 or 2 to die. Okay, or even 4, living 2. So that's been the reason from if you talk to people in the village, they will tell you.
But now with lower mortality rate, instead of 3 out of 5 dying, they might only 1 out of 5
That's
might
correct.
die.
1 out of 5 might die, or 1 out of 7 might die, living 6. So this, helps the population to grow. Now we've talked about HIV/AIDS. About 20 million, people affected in Africa and all this. But the fact is that HIV/AIDS have crossed the threshold of fear amongst people in Africa now, like it used to, that people are seeing it as a disease, not a curse, and fighting it and taking their medicine. So the death rate, even with HIV/AIDS, is
stabilizing.
Exactly, it's stabilizing. So more people are not dying like they used to initially.
Well, and so Dr. Madu, we've got about 30 seconds before we end this today, but what you're doing, you're really bringing about an alarm in reference to this increased population growth, and even if only other countries can take an example of what is happening in Africa and start making those kind of plans, because while the population in other countries might not be as explosive, we are still having problems in some of these other countries, and so Africa in a real sense can serve as an example of what will happen if we don't deal with the infrastructure and some of the other things that we're talking about here. And of course, let me thank you for bringing that information back, and let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.